Okay, so right now I want to discuss cardiac catheterization. And this is a procedure that we utilize to diagnose atherosclerosis in the coronary arteries or angina pectoris. And so what the procedure entails is the insertion of a catheter through either the femoral or brachial artery that goes all the way into the aorta or and down inside the coronary arteries. And what the catheter does is it injects a contrast medium solution, so we can then take some diagnostic imaging and we can verify atherosclerosis in this circulatory system of the coronary artery supply. So what you really want to focus on as a nurse is you want to focus on your pre-procedure assessment, okay? Your pre-procedure assessment, and then also your post-procedure assessment. It's imperative that as a nurse, we can educate the patient as to what type of elements the patient's going to be going through when the catheter is being inserted. So for instance, during the actual procedure, the patient's going to be on some degree of conscious sedation, and we're going to be inserting the catheter through the femoral or brachial artery, and the catheter will then make its way through the abdominal aorta, thoracic aorta, aortic arch, and inside the coronary circulation, or from the brachial artery through the aorta into the coronary circulation. We try to not utilize the upper extremity, the brachial artery, because there's more practical use for the upper extremities than there is the lower extremities. And after your procedure, you're going to be ensuring that the patient keeps their legs straight. So you want to not immobilize the extremity that's for more practical use. So we like to use more so the femoral artery when we can. So the pre-procedure assessment involves us assessing the neurovascular status. And what I mean by neurovascular is the nerves and the vessels of the lower extremities. So what we use is CMS. We have to assess the circulation, the motion, and the sensation of the lower extremity. We're talking about the dorsal pedal pulse, capillary refill, anterior posterior tibial pulse. Any of those elements that can give us details about the circulatory status, we have to assess that. That's the vascular portion of the neurovascular assessment. We also have to assess the motion. Can the patient wiggle their toes? Can they move their foot? And then we have to assess for sensation. We stroke the side of the foot. Can the patient feel this? Once we've assessed the CMS, the circulation, motion, sensation, then we have our foundation. We have our pre-procedure baseline that we can refer back to after the procedure and compare it to the post-procedure assessment to see if there's any deficits, any changes, which would indicate a potential complication that occurred during the procedure. For instance, the catheter might pass through the entire femoral artery and there may be some internal hemorrhaging going on, which would limit the perfusion to the lower extremities. And that's something that's going to be evidenced in our post-procedure assessment. So we always conduct our pre-procedure assessment to have our baseline of assessment, including vital signs and stuff like that. But right now we're focusing on the specifics. During the procedure, your role is going to be mostly on education. You're going to be educating your patient. Sir, the catheter is going to be inserted in through your coronary artery supply. You may feel a fluttery sensation, and that's all expected. Your goal is to reduce the patient's anxiety. So education and anticipatory guidance, which would be what you're going to be preparing your patient to anticipate. And you're going to be guiding them through that procedure, through the information, so their anxiety can decrease. That's your job as a nurse. You're also going to be telling that they're going to have a little bit of a contrast medium injected into the coronary artery supply, so we can then take some diagnostic imaging so we can diagnose the atherosclerosis if there's any present. When the contrast medium is being injected inside the circulatory system, you want to educate the patient that they may feel a warm flushing sensation, a metallic taste in their mouth, or the need to void, a warming flushing sensation that makes them want to pee almost. And you want to educate the patient about those elements. After the procedure, the catheter will be removed. There's going to be pressure placed on top of the insertion site, perhaps with a pressure dressing and even some sandbags to apply pressure without the nurse staying there for all that time. And after the procedure, the patient will be positioned in such a way that their extremities are going to be kept straight. The purpose for that is because if this is the artery and this is the insertion site, if you start flexing the hips, well, then that insertion site is going to continue to bend and it won't be able to clot. I'm not talking about DVT clot. I'm talking about the blood vessel wall. It needs to patch itself up. So we must ensure that the patient leaves their legs straight for several hours, 6 to 8 hours. The patient may be placed on bed rest for up to 12 hours. The whole purpose is to immobilize the extremity, or that extremity, depending on which one we're using, to prevent any mobilization or flexion so the blood vessel wall can patch up and we can start bleeding, so we can stop bleeding, because the whole goal is to promote hemostasis, the cessation of bleeding. At the same time, we discuss the post-procedure assessment. After the procedure, we do our assessment. We compare it to our pre-procedure assessment and find out if there's any deficiencies, any deficits, any abnormalities, any significant changes in the pulse sensation. Maybe the capillary refill was less than 3 seconds before the procedure. We want to report anything that goes outside of those parameters. Maybe if it's 4 seconds, anything that indicates potential internal bleeding. Same thing with the pulses. If the pulses were strong and now they're weak, that requires further assessment. So we report those elements. Same thing with the motion and the sensation. Keep in mind that your patient's head of the bed has to remain flat, less than 30 degrees, because the flexion of the elevation of the head of the bed will also flex the hips, which will contribute to the flexing of that blood vessel. That's going to contribute to the inability of the blood vessels to clot. Okay. One more thing that I want to mention is when somebody is having cardiac catheterization, it's important that we consider the patient's overall well-being, right? So we will be assessing vital signs, not in the extremity that the blood pressure, that the access port, that the access was created in. We also have to consider the type of procedure sometimes has a balloon in the catheter that goes inside the coronary circulation. And so we can do balloon angioplasty, meaning where we fix the atherosclerosis, where the atherosclerosis the blood vessel might have some plaque buildup in there. The balloon goes inside, the balloon then is inflated, and it converts that occluded atherosclerosed blood vessel into a more patent blood vessel where perfusion is much readily able to pass on through, right? The balloon angioplasty may also have the stent, a little device that goes around the balloon, stent placement, which will keep the stent inside the lumen of the blood vessel to prevent it from occluding again. Keep in mind that patients with stents will probably be on blood thinners afterwards to prevent any potential clotting, so they'll be on anticoagulants prophylactically. And talking about your blood thinners, there's one thing that I forgot to mention. When we're doing our pre-procedure assessment, we also have to review the patient's medication list. Since this is an invasive procedure inside the femoral artery, which is a highly vascular, highly pressurized blood vessel compared to your venous system, you have to assess for any potential bleeding. And if the patient's on aspirin, on heparin, on Coumadin, on clopidogrel, any medications that are considered blood thinners, you might have to question those, and you might have to wait till those lab values that are associated with those blood thinners are to their desired levels that the doctor expects to be in before we actually continue with the procedure. And those are the type of elements that you got to consider when you're having cardiac catheterization.